Hi, everyone. Thanks for working with me on this while I stay home with my daughter who's sick today. But I didn't want to miss out on today because last week we were out with Martin Luther King Holiday Monday and a snow day Wednesday. So today we are going to start our new chapter, chapter 8, which discusses bleeding. So up until now, we've talked about the importance of first aid, how to recognize emergencies, when to call 911, Good Samaritan law, negligence, breach of duty, that type of stuff. Now we're going to actually start getting into um, specific conditions. We already talked about head to toe exams and always looking for life-threatening injuries first. So chapter 8 discusses bleeding. Chapter 9 is wounds, and the next chapter is shock. So those three will kind of round out our first unit. So today is just chapter 8, bleeding. All right, so I think you've probably all seen blood before. Blood comes out of any type of open wound. A hemorrhage is a large amount of bleeding in a short period of time. And the worry with hemorrhage is shock. If you cannot control the bleeding, there won't be enough blood left to circulate. The heart won't be able to pump enough blood and oxygen around, and people can die from a hemorrhage. The average adult, we said, has about 5 to 6 quarts of blood, which is 10 to 12 pints. And again, rapidly losing 2 or more pints for an adult can lead to death. Children, obviously, since they're smaller, a pint or more in rapid succession can be deadly. Different types of bleeding: capillary, venous, and arterial. Capillary and venous blood you may have seen. Arterial is a bit more rare. Capillary is the most common. This is your typical scratch, fall, paper cut that bleeds. It oozes steadily, slowly, usually stops by itself, very easy to control, generally not a problem at all. Venous is a bit of a deeper wound, so it's cutting a little bit deeper. The blood is going to flow more rapidly. You know, if you've ever had blood taken and they pull the needle out of your arm and it might bleed a bit more steadily, it's darker in color. That's what venous blood is. Again, usually it's fairly easy to control with direct pressure. Arterial is the one you would worry about the most. This would be a significant injury because arteries tend to run deeper than veins. So it's a deep injury. Blood tends to spurt, projectile from a wound, can lead to rapid blood loss very quickly in a short period of time. Bright red blood doesn't really clot off by itself, requires considerable amount of pressure, elevation, possibly a tourniquet, although in most instances they do not recommend the use of a tourniquet. But arterial wounds are going to spurt, they're going to flow very quickly, and a person is at risk of rapid blood loss and shock. So your body has a lot of natural defense mechanisms that it tries to help itself when it's bleeding. So one is blood vessel spasm. When a blood vessel is completely severed, it tends to draw back in towards the tissue. It tends to constrict or tighten, which will naturally slow the bleeding, which is why sometimes if you have an injury like an amputation, if it's amputated all the way, there may not be a lot of blood because those blood vessels will pull back into the tissue. If it's just partially severed, the vasoconstriction might not be complete. It may not contract as well, and the blood loss may not slow as dramatically as it would if it were completely cut. And then clotting, of course, is our body's defense mechanism. When we have an injury, platelets are sent to the area. It forms a blood clot, which stops the flow of bleeding. That blood clot or becomes a scab, serves as a protective covering for the wound. So if it was clean before it scabbed over, it's much harder for bacteria to enter a wound. So normally it can take about 10 minutes for a healthy person to clot, depending on the type of bleed it is. Again, if someone has a bleeding disorder, if they're on certain medicines like blood thinners, it may be harder to control the bleed. And that's why you'd want to know if somebody takes certain medicines. So what do you do for external bleeding? Protect yourself, like we always talked about. Gloves, if you have them handy. You're dealing with body fluid. And again, always want to assume that people are contagious, whether you know they are or not. Expose the wound as best you can. If it's a shirt, you can roll it up. You may have to cut it. Again, modesty is a good policy to always keep in mind, but you need to be able to get to the wound. You need to be able to expose it and see what needs to be done. Cover it with a clean, sterile gauze would be the best. If it's not sterile, at the very least clean would be helpful. And direct pressure. Direct pressure is going to stop most bleeding. So firm, hold it on there. Remember, if the victim has a lot of different injuries and they're conscious and able to help you, you can have them, for example, in the picture you're looking at, the person can use their own right arm to kind of put pressure on their left arm while you're looking at the rest of their body and examining for other injuries. So don't be afraid to ask the victim for help if they're capable and you have other things you need to examine. And then a pressure bandage. So when you have direct pressure, and then you can wrap a bandage around it, which is going to keep that the dressing in place. Just be mindful that when you're wrapping it, that you're not wrapping it too tight because you don't want to cut off circulation. And how you would know that is by checking the pulse. Check the radial pulse. We said which is the pulse down at your wrist on the thumb side. And periodically check that. Make sure they have a good strong pulse, good color, and good skin temperature. Don't apply a tourniquet unless EMS tells you to do so. Tourniquets are designed to constrict everything, to try and get down to that deep artery and cut off the blood supply and stop the bleeding. Unfortunately, what it also does is it damages muscle, it damages tissue, it damages nerves and blood vessels, and can actually lead to loss of a limb. So only when other means are not working should you apply a tourniquet, but there are times when it'll be necessary. You always want to reassure the victim. Even a small amount of blood can look like a lot of blood, and people can become very anxious. Keep in mind, the face is very vascular, the head is very vascular. A wound to the face will bleed and bleed and bleed, and it may be a very minor cut, but it can still bleed a lot, which would be frightening. Some other things to remember. When you are dressing a wound and you put gauze on or you put a bandage on and the blood soaks through it, we don't want to remove that dressing and put fresh ones on. What you want to do is add new ones on top. The reason being is because if that dressing was soaked and we tried to remove it, if the body had already started to try to clot off, when we remove that dressing, the clot would come off with it and it would restart the bleeding. So just continue to add new ones on top and rebandage. And then at the hospital, they can soak the bandages and get them off the right way. If it's an eye injury, we don't want to put direct pressure on the eye. If there's an embedded object like a pencil or a knife or something is embedded, you want to put pressure around that object and not putting pressure on an open or suspected skull fracture. And we'll talk about those a bit more as we get into each of those body parts. And then again, make sure if you're applying a pressure bandage that you check for a pulse and make sure that it's not too tight, but you don't want to make sure that it's too loose, that it's not really applying the type of pressure that you need. So external injuries are much easier to spot. Internal injuries are very difficult to spot, and they can be life-threatening, and when they're missed, they really are a source of significant morbidity and mortality. So with internal bleeding, the skin isn't broken, you don't see any blood, but there's trauma to the inside. Usually this would be a result of some type of blunt force trauma, a chest hitting a steering wheel, getting hit with a bat, falling on the ground and hitting your head, something like that. The ones listed below, bleeding stomach ulcers, lacerated liver. This would be in a significant car accident, a lacerated or ruptured liver or spleen. Broken bones. Remember, we said those big bones run along the big arteries. So it's possible you could break a bone and rupture an artery and not really know it. And we talked about the largest artery in the body, which we said was the aorta. And the largest vein is the inferior vena cava, which returns blood supply from the body back to the heart. Again, damage to one of these blood vessels is almost always going to be life-threatening. So what are some signs that might help us recognize internal bleeding? Any kind of bright red blood coming from the mouth or rectum, or especially if there's no injury. If there are no cuts or lacerations to the face, but someone has blood coming out of their mouth, then I'm thinking a blood might be coming from the GI tract. If they're vomiting up blood, that would be something. Again, bleeding from the rectum, blood in the urine, without any trauma to those areas, should be a red flag to you that there might be some internal bleeding. Same thing, non-menstrual vaginal bleeding, vomiting or coughing up blood. It may be bright red blood, or it may be very dark, what they typically call coffee ground appearance. Dark, it's not going to smell right, it's not going to look right. Black or foul smelling stool, anything abnormal from what you might expect could be a sign of internal bleeding, possibly from a colon cancer, possibly from a lacerated large or small bowel. Pain, tenderness, bruising, swelling. If the person is guarding, if you go to examine their abdomen and they kind of wince before you even touch them, things like that, pay attention to their body language. If the abdomen is distended, if it's kind of firm instead of soft, all of those would be indicators of a possible internal bleed. And again, also think of the type of trauma that occurred. If you recognize that it was a car accident, if you recognize someone was thrown from a motorcycle, then internal bleeding is something that should automatically be suspected in your brain. So what do you do? It's not a whole lot you can actually do for someone. Monitor their breathing. Always make sure they're open their airway. Make sure they're breathing. Make sure they're still circulating. You can roll them onto their side if they're vomiting, again, so that they're not going to aspirate that vomit, that it's going to come out the side. You can treat a victim for shock, which we will learn how to do. One of the treatments for shock is raising the victim's legs and keeping them covered. But if you suspect a spinal injury, we wouldn't want to raise their legs, but we'll talk more about that later. If there's a suspected broken bone, you can learn how to splint it, which we will do. And basically, your best thing you can do is make sure 911 is called. Don't give them anything to eat or drink, because if they have internal bleeding, if they need surgery, it's best if they don't have anything in their stomach, so they are less likely to vomit during surgery. Bruises, pretty self-explanatory. I think you've all suffered some bruises before. It is a form of internal bleeding, but it's much more superficial. They're generally not life-threatening. They usually go away on their own. You can apply an ice pack, which will help the blood vessels to constrict, or remember, get smaller, which will help decrease the amount of bleeding. It will also help decrease pain. It will also help decrease swelling. And then you might also consider applying a compression bandage. Compression, again, is going to help with swelling. Remember, whenever you have an injury and it swells, that swelling also puts pressure on nerves and surrounding tissue, which what contributes to pain. So between ice and compression, you're constricting the blood vessels, you're decreasing the amount of swelling, which takes pressure off the nerve and the surrounding tissues and can help decrease pain. All right, so I just wanted to go over Chapter 8 with you today. We are going to go over Chapter 9 on Monday, and then we'll go over, I believe it's Chapter 7, which is shock, on Wednesday. We will have some a bleeding and wounds lab that will practice wrapping and bandaging up different injuries, and we'll have different case studies that you can work on to see how you might treat individuals. So go through this. On Monday, you'll have homework for Chapter 8 and 9, but nothing for today. And then we'll just pick up there next week. So again, thanks for your understanding. I'm sorry that again that I wasn't there today, but hopefully you've been able to print out your note guides and follow along and fill in your note guides as you've watched this today. So enjoy the rest of your week. Have a good weekend, and I will see you on Monday.